Hey there, healthcare heroes! Today, I'm diving into the essentials of mechanical ventilator care, sharing top secrets on how you can provide effective support for your patients. Grab a cup of coffee, and let's get started. First off, what exactly is a mechanical ventilator? Essentially, it's a machine designed to support or even replace the function of the lungs. It delivers air, or a mix of gases, to the lungs, ensuring adequate oxygenation and removal of carbon dioxide. You'll typically see these in cases of respiratory failure, surgeries under general anesthesia, or in critical care settings. Now let's break down the main components of a mechanical ventilator. We have the ventilator unit, which houses the control systems and power source. The breathing circuit connects the ventilator to the patient through tubing. A humidifier adds necessary moisture to the air, preventing the drying of the airways. The patient interface could be an endotracheal tube, tracheostomy tube, or even a face mask. Lastly, alarms and monitoring systems are crucial for alerting the healthcare team about any issues like disconnection or low oxygen levels. Alright, moving on to the modes of mechanical ventilation. We have volume-controlled ventilation, or VCV, which delivers a preset tidal volume. Pressure-controlled ventilation, or PCV, delivers air until a preset pressure is reached. Assist-controlled ventilation, also known as ACV, provides a breath every time the patient initiates one, or at a preset rate if they don't. There's also Synchronized Intermittent Mandatory Ventilation, or SIMV, which allows spontaneous breathing between preset breaths. And finally, Continuous Positive Airway Pressure, or CPAP, keeps airways open with constant pressure, often used for weaning. Now let's talk about nursing care for patients on mechanical ventilators. Starting with assessment and monitoring, regularly check vital signs like heart rate, blood pressure, respiratory rate, and oxygen saturation. Listen to breath sounds to ensure adequate air movement and detect any abnormalities. Always verify that the ventilator settings match the prescribed parameters and promptly respond to any alarms. For airway management, ensure the position and patency of the endotracheal or tracheostomy tube. Perform suctioning as needed to clear secretions, but avoid oversuctioning to prevent trauma. Make sure the humidifier is working properly to avoid mucosal drying and thick secretions. Infection control is paramount. Practice strict hand hygiene and use sterile techniques during suctioning and when handling the airway. Perform regular oral care with antiseptic solutions to reduce the risk of ventilator-associated pneumonia. When it comes to comfort and communication, always assess for pain and anxiety, administering sedatives or analgesics as prescribed. Use communication boards or nonverbal methods to interact with patients who can't speak. Preventing complications is also key. Regularly reposition patients to prevent pressure ulcers and promote lung expansion. Monitor for abdominal distension and provide care to prevent aspiration and gastric complications. Collaborate with the healthcare team to assess readiness for weaning and gradually reduce ventilator support. Finally, don't forget about education and support. Educate the patient's family about the ventilator and the patient's condition. Provide emotional support to both the patient and their family, addressing any fears or concerns they might have. By following these principles, you can ensure your patients receive safe, effective, and compassionate care on mechanical ventilators. Thanks for tuning in and keep up the incredible work. Remember to like, subscribe, and hit the bell icon for more insightful content. Stay safe and take care.